Well, hello, this is Paula Anderson with Paula Anderson Coaching Consulting. So welcome to another edition of Medical Coding with Paula Anderson Coaching and Consulting. So today we're going to be talking about basic medical coding. So if you have your CPT manual, I want you to grab that so that you can follow along with some of the information that I'm going to be presenting to you. So this session is for educational purposes. It is not designed to give any type of medical coding advice. And this presentation, which is just for me giving you a visual and an audio of basic medical coding. So my name is Paula Anderson, and I'm with Paula Anderson Coaching Consulting. I have certification as a certified professional coder, a certified professional biller, as well as an AAPC approved instructor. And so I've had those certifications. I got one certification in 2002, and then I got my instructor certification in 2017, and my CPB in 2024. So today we're just going to go over the basic concepts of medical coding. Now, a lot of people get into medical coding not really understanding what is required of medical coding. And so one of the things that I want to do is explain to individuals that medical coding, you should not enter the field of medical coding just because you want to work from home. Now, ideally, that is a good goal to have, but that should not be your primary purpose for entering the field. You want to enter a field because it is something that you enjoy doing, it's something that you can add value to, and it's something that you want to share with others. So if you have your CPT manual, we're going to go over the following things. We're going to talk about Category 1, we're going to talk about Category 2, Category 3, the coding conventions, the symbols, a few CPT modifiers, and then we're going to talk about the CPT index. So this is a question that I want you to ask yourself as we get ready to do this presentation, or as I get ready to do this presentation. Why are you interested in medical coding? What is it about the field that interests you? What is it about the field that attracts you? What is it about the field that wants you to invest your money and your resources, and your time and your energy? So Category 1 consists of the 6 sections in the CPT manual. So you have evaluation management, you have anesthesia, you have surgery, you have pathology and laboratory, you have radiology, and you have medicine. So the E&M section, which is the sections that's at the beginning of the CPT manual, it is the most frequently used section within the CPT manual. So that's why it's at the beginning. The surgery section is the most widely used section in the CPT manual because it has most of the codes. So the surgery section is divided into subsections. So you have integumentary, you have musculoskeletal, you have cardiovascular, you have respiratory, digestive, female genital system, urinary, the eye, the ear, the nervous system, the endocrine system. So you have all those different subsections that fall under the surgery system. Now, I'm not going to go into a whole lot of detail with the other sections, radiology, pathology, and laboratory, but the medicine section is another comprehensive section because a lot of specialty doctors use the medicine section for services that need to be billed. So Category 2 is a set of supplemental tracking codes used for performance measurements. So these codes are used to determine what type of clinical situation has occurred in the doctor's office without having to provide the medical record to the insurance company. So these codes are going to be alphanumeric, and you'll find these in the back of your manual. Category 3 is a set of temporary codes for emerging technology services and procedures. And so these are codes that are still in an investigative or experimental status. So you want to make sure that if you assign these codes, they may not be valid, but for a certain period of time, and they may move up to a level 1 code, which is a Category 1. So the coding conventions, we have the semicolon, which is a punctuation that you will find in a description of a code. And so if you look at code 45378 in your CPT manual, you will find that semicolon. Then you have the indented format. So the indented format is telling you that there is more information that goes along with that code. So if you look at 45378, that code is not indented. But if you look at 45380, you'll see that it is indented. So the indented code is You use the indented code in addition to as far as the language that's listed for 45378. So it's actually colonoscopy flexible and then the specifics of the indented code. So that's how you do that. Now, the authors of the CPT manual did not want to repeat all of the wording. So that's the reason why there's the indentation. So once you understand this concept, then you'll be able to code accurately when you look up this code from the index and you see that it only has, it's the indented code and not the full description. So turn to these codes in your CPT manual. So look at 57556, 57556. And I want you to think about what is the parent code. So I give you a few minutes to think about that. And then I want you to look at 57461, 57461. Tell me what the parent code is for that. And then the code 86698. 86698. I want you to give me the parent code for that. So these are just 3 examples of the indented code. So you need to find the parent code. Now the symbols. So the symbols guide you and help you to understand how codes are within the manual. So you have your revised code, which means that there's been a revision to the description. We have your new code. So when new codes come out at the beginning of the year, you're going to have that symbol. New or revised text. So that means that they've changed the wording within a paragraph. So for instance, when the E&M guidelines changed in 2023, there were a lot of side triangles that was listed. You have reference to CPT Assistant, which is a newsletter that you can subscribe to for more instruction related to medical coding. Add-on codes, meaning that these codes cannot stand alone. So an example of this code would be 90472. That's 90472. And then you have exemptions to Modifier 51. So Modifier 51 means that it's multiple procedures. And you have to have 2 related procedures in order for the second procedure to be considered multiple. And we'll talk a little more about multiple procedures when we get to the modifier section. Product pending FDA approval. So that just means that the Food and Drug Administration is reviewing that particular CPT code. Out of numerical sequence, which means that the codes are not in numerical order. Telemedicine, which is indication that those codes are used to bill for telemedicine services. So we know that during the COVID pandemic, the majority of physicians were using telemedicine services or telehealth services in order to see patients, but those guidelines have changed since that time. Audio only, meaning that the service can be billed from an audio only perspective. Now, I have not dealt a lot with the duplicate PLA test and the category 1 PLA test, so I don't have any examples about those 2. So CPT modifiers. So the CPT modifiers are found in the very back of your manual, and they're in Appendix A. And so modifiers do 2 things. They provide information, and then they also affect reimbursement. So I'm going to look at 6 modifiers. We'll look at 24, 50, 22, 51, 52, and GA, which is a HCPCS modifier. So 24 means that it's unrelated E&M service during the global period. So if you think about a major procedure such as a breast mastectomy. So anything that is done related to that breast mastectomy is going to be bundled into the surgical period, all right? The major, the post-operative period. But if the physician sees the patient for something that's unrelated to the major procedure, and we're using breast mastectomy as an example, then that can be a billable procedure and you apply modifier 24. So you always want to check with your Medicare administrative contractor in order to determine whether or not you need to, how you need to apply the modifiers, because there are policy guidelines on specific modifiers. Modifier 50, which is bilateral procedures. And so this is indicating that you're doing a procedure on the left and the right side of an organ or body area. So you think about, you have 2 eyes, you have 2 ears, you have 2 breasts, so you have 2 kidneys. So think about those body areas where you have a left and a right. Modifier 22 means that it's an unusual procedure service. And so that means that there's something specific that the physician is doing when he is performing that procedure. So he started out doing one thing, but then he deviated and started doing something else. And so he or she wants to get reimbursed for that additional work. And so that's what the modifier 22 is used for. Now, again, you want to check the payer policy guidelines to make sure that the documentation supports the usage of modifier 22. Modifier 51 is multiple procedures. So most procedures means that you have two procedures that are related. They're done during the same encounter. So two examples that I will give you, an excision of a lesion that was done, a malignant lesion was removed, and then we have the repair, an intermediate repair. So of course, if they take the lesion off, then they gotta close the patient back up. So why should the physician get billed at 100% for both those procedures when he's only doing 50% of the work? So that's what modifier 51 indicates, that it's only 50% that's going to be reimbursed. Modifier 52 is reduced services. So it doesn't have a specific reason why. So what you want to do is you want to check your payer policy guidelines and determine whether or not it is appropriate to be a modifier 52. But again, it indicates that it's reduced services. And then the last one is GA, advanced beneficiary notice. So what this means is that a Medicare patient is going to have a procedure done, and that service is not going to be covered by Medicare. And so the patient needs to be aware of that before the procedure is done. So it should not be right before the procedure. It should be days or weeks before the procedure to give the patient opportunity to know whether or not they are able to pay for the procedure. So when you appear modifier GA, you're actually telling Medicare, all right, we have this ABM form on file in the patient's chart, and so you can bill the patient for the service. So it's very important that you know whether or not that ABM form is there. Now, let's get to the coding. So coding, I think, is if you're someone that likes to research, if you're someone that likes to solve problems, I think that coding is an industry that you will enjoy. It's not one of those fields where it's very glamorous, but you do have to have a strong knowledge base of certain things. And so medical terminology, of course, lays the foundation. But then once you get the medical terminology, then you want to focus on the coding and reimbursement guidelines. So my experience has been, so I worked at a company in Memphis for about 14 years total. And so I learned medical billing first. So that was my first job, was medical billing. Well, actually, I was a coding clerk first for when I was in high school. But I did that for a short period of time. And then I switched over to billing, the follow-up side of things. So my foundation was laid early on. So I never did attend a school for medical billing and medical coding. So I did learn on the job. So that's just want to share that with you. So when you're getting ready to code your procedures, you want to go to your index, which is at the very back of the manual. Now, a lot of individuals, when they're taking the CPC exam, they look at all the answers and then they make a selection based off of that. Well, that wastes your time. So that's not a really good strategy for you to use. So what you want to do is you want to actually code it. So you have 4 things that you want to consider. So the procedure or service name, you have the organ anatomic site, the condition, the synonym, eponym, and abbreviation. So you want to find your keyword or your main term based on one of these criteria. So I'm going to give you a few examples so that you can code these on your own. So we got a bilateral vasectomy. All right, so what is the procedure here? Bilateral vasectomy. So vasectomy is going to be your keyword. Laparoscopic adrenalectomy. So adrenalectomy is going to be your keyword. Complete mastoidectomy. That's going to be your keyword. Radical breast mastectomy. That's going to be mastectomy is going to be your keyword. And then you're going to need to know more about what type of mastectomy. So that's when the radical aspect is going to come in. Total abdominal hysterectomy. So hysterectomy is going to be your keyword. And then diagnostic colonoscopy. So colonoscopy is going to be your keyword. So when you look up your main term, it's going to give you a specific code. So maybe you use your main term and then you may have to use a subterm. So like with the mastectomy, we're using the main term of mastectomy, and then there are different types of mastectomy. So I think it's a simple, it's a complete, it's a modified radical. So that's when you want to make sure that you're looking up the right type of mastectomy. So if you would go to your CPT manual, it doesn't matter if you have a 2025 or 2026 edition, then that's going to be fine for you to use to prepare and to study. Okay, when you get ready to take the exam, you need to make sure that you have the current edition because the exam is going to be based off of the current edition of the CPT. ICD-10 and HCPCS manuals. So that concludes this presentation on just the basic guidelines. One of the things that I've been doing over the last month is giving individuals that are already in medical coding or individuals that are interested in medical coding, I'm giving them some specifics about what medical coding is and what it is not. So I probably will continue to offer these basic medical coding webinars to individuals just so that I can connect with individuals outside of my city, which is Memphis, and help individuals on their journey to be a medical coder. So thank you so much for watching this video. Stay tuned for the next video with Paula Anderson Teaches Medical Coding.